Hi, everyone. So we gave a couple minutes for everyone to join if someone's a little bit late. So welcome. I'm Damian. I'm here to talk to you about the force visualization feature we added recently to Vision. And the topic is forces in focus. So our job here is to understand the physics behind every movement that's happening in Vision. I'd like to start with a disclaimer that this is not a clinically focused discussion. Rather, this would be a under the hood exploration of how Vision calculates forces and how it visualizes them during setup. So that's a disclaimer, right? So just to start with a little bit of context, which I'm pretty sure everyone here is quite familiar with, but just to give it a bit more context. So we're talking about attachments, and the primary purpose of this new feature is to help with attachment placement. So attachments are there to introduce additional irregularities on the surface of the crown so that the aligner has more surface to grab onto and more edges and ridges to grab onto and to apply forces. Therefore, it's very important, it's critical to make sure that the placement of the attachment, as well as its orientation, is optimal. So traditionally, what you would do in a traditional treatment planning software, you would manually place these attachments. You would pick the shape. You would figure out where you want to place it, primarily or largely based on your intuition and your expertise, right? Your clinical experience of knowing how it should be oriented and where it should be placed. Again, just for the context, I'll quickly switch to Vision. Right here, show you this little demo case. It's not a very clinically accurate case, but it should suffice for the demo. So we have some teeth movement, and in Vision, as you're probably aware, there is this attachment panel here, which allows me to pick attachments, pick an attachment shape, and then place it manually. Traditionally, I would look at how the tooth is moving and figure out, okay, so it looks like there is a rotation here, and I'll probably rotate it 90 degrees to turn the edge over there. But this is mainly based on my intuition. So it's based on that. I'm doing that more or less blindly. Therefore, there is a problem, right? So the problem is that there is a gap, and the software, the traditional software, is lacking a tool, a guidance, right? A visual guidance in the software to figure out what the optimal place for an attachment and what its orientation should be, right? And this force visualization feature I'm presenting to you is our first step in the direction of making Vision more computationally guided and physics aware. So we want our treatment plans to be guided by physics and math and geometry. So for the purposes of UI, just to introduce to you where this new feature is located and how to enable it, we look into the same little panel here. You will notice that there are two additional toggles here. They're titled movement vectors. So as soon as I toggle it on, you'll see Vision displays these movement vectors for the teeth that are moving currently at this step. I can either toggle the show on all teeth, the toggle off, so that it only displays the movement vectors on the tooth that is currently selected, or if I toggle that on, it's going to be constantly showing them on all teeth. So this is what the feature looks like, right? And without any additional context, it might be a little bit confusing to how to interpret these forces. And right now, I'm going to try and explain how to interpret them, how to use this feature. So two very important factors here, right? You look at the vector field, right? And these little arrows, they're all pointing in different directions, and they have different lengths, right? Some of them are shorter, some of them are longer, and some of them are swirling around a point. Some of them are just uniformly or unidirectionally pointing in one direction. So one main takeaway here, the rule of thumb, the first rule of thumb here, is to try and place your attachments perpendicular to the arrow direction. So that's one rule of thumb, right? If I want my active edge to be optimally engaged by the aligner, I want it to be perpendicular to the direction of these arrows. That's the first rule, essentially. The second rule is to make sure that the attachment is placed in the area with the longest arrows. The concentration of arrows should be, the concentration of longer arrows should be higher. So this point looks not very effective. But when I look here, I can see that there are a lot of long arrows there. So if I'm placing an attachment, I should probably place it there. And this is the guideline, right? So these are the arrows. These are the visual guidelines for you to look at when you're placing these attachments. If there's nothing else to take away from the webinar, these are the key two takeaways, the key rules of thumb that you can use when you're applying these attachments. I can also tell that my previous manually placed attachment isn't actually optimal for this movement, and I should rotate it slightly. This is the one I placed before I toggled the movement vectors on. Also, you'll see that there is, as I'm moving the tooth, as I'm changing my planned movement, the lengths of these arrows are changing. So the vector field is calculated in real time. The smaller the movement, the smaller the rotation and smaller the movement, the shorter the arrows are. And if I add extra movement to the tooth, you'll see that the arrows get longer. So these are the visual interpretations of what the vector field looks like. Also, it's quite important. You can actually see these vectors on the lingual side, right? If I hide the lower, because sometimes you might want to place lingual attachments, and a similar kind of rule will apply on the lingual side. Right? We could talk a bit more about the shape. And like I mentioned, you'll notice that the intrusion and extrusion movements for this tooth, it's a pure extrusion here for demo purposes. You'll see that the arrows are more or less uniformly, unidirectionally pointing upwards. And for discalization movements here, we're seeing these interesting characteristic swirl patterns. And you would not necessarily, this is not necessarily a universal rule, but this is typically the rule you'll see, that you will see these swirls on these types of movements. So if you're so inclined, you can also investigate, we could look into the way that the software calculates the forces. I'm hoping this slide is more informative rather than confusing. It might be a little bit overloaded, so I'll just guide you through the most important things. So as you know, there is a center of resistance somewhere around the middle of the root, and there's the actual crown. I'll first demonstrate the force calculation here, and then I'll switch to vision to show what I mean by the central root and the point on the surface. So the key thing here, key thing to take away from this slide, is the fact that when we're moving a tooth, all the forces and the moments, the planned movements, essentially require a moment of rotation and a translational force at the center of resistance in order to move the tooth to the desired position. However, we can only apply forces on the crown. Therefore, we need to figure out what the force and the moment, rotational moment, needs to be at the place, at the point on the crown, so the crown point. What we do during this calculation, we take the force as is, and the translational transformation of the force is, it doesn't change it, so it's actually equal. However, for the rotational moments, we end up having to modify the original moment here with a little bit of calculation. So I'm not going to go into too much detail, but the point is that it needs to be modified by the cross product of the lever, right, lever arm here from the point of center of rotation to the crown point, and the cross product of that with the original translational force required. This is just a little bit of explanation here. I'll switch back to vision and show you what I mean by that. So in vision, we have the ability to visualize what the center of rotation for a given tooth is. In case of this tooth, if I toggle, so if I switch between different points of rotation here, I can switch to center of resistance, and this will be my center of resistance. And the calculation happening, the calculation I just showed you on the slide is happening right here for every point on the surface. And for every point, we did that calculation, and we ended up with a little arrow, which we draw here. And this is essentially just the mechanism behind how, these vector fields are calculated. So I think it's important to mention now that we know how it works, more or less, how this force calculation and visualization helps clinicians, right? So first of all, like I said, the main purpose is to show where mechanical force generation is optimal on the crown surface, which will improve attachment shape and placement decisions. It's not just intuition. It's not just me basing it on my visual perception of how it's happening. And the general kind of aim here is to increase predictability and reduce the need for refinements, right? The idea is if your attachment placement is more accurate, there is less chance or less risk of something going wrong. So the operational and patient benefits that we hope to see by introducing this feature is that the adherence to the planned tooth movement is going to be better. So there's going to be no deviation. So fewer repeat visits, fewer refinements, greater predictability, and fewer mid-course corrections. These are the things we're also hoping to see by introducing a computationally guided attachment placement. And of course, ultimately, this leads to improved patient satisfaction and retention. And that's essentially the main goal here. This more or less concludes the demo. I think we can go and talk about any questions that you guys have. Yep. Welcome to everyone. I'll be reading out questions. Presentation screen size. Sorry, I just noticed that. Presentation screen size. I'm not sure I can actually. I think what we should do, we should share the presentation itself along with the video so that people can actually look at the video and the presentation at the same time. How do you recommend placing attachments when the force vector becomes circular? Right. How exactly does the circle appear? The rotation is not always happening around a single point. That is absolutely true. So it's a very important point that the arrows don't actually tell you how the tooth is rotating. It's not at all that. What the circles tell you, or the arrows tell you, is if you were to pull the tooth, like grab a point on the tooth, where you should be pulling it to achieve the desired motion on the center of rotation, or it's a resistance point, right? That's what it is. It's not what the tooth is rotating. In fact, if I do a pure distalization movement, like for instance here, so I'll just switch here. So we're looking at the tooth, this one, for instance. It's doing essentially more or less a pure distalization move. It's moving mesially distally to distalization. And you can see that there is a swirl here. And yeah, and there is no rotation. The reason why there's a swirl here, this like a torrent pattern here, is because in order to resist the tipping rotation that would be introduced by purely moving the tooth, right? You can imagine, so if I toggle on the gum, right? It's sitting in the gum, it's sitting in the bone, in the PDL. And if I just do a pure kind of apply a translational force here, I hope you see my mouse here, you're going to introduce some tipping. And in order to resist that tipping, you need to have some kind of opposite moment, rotational moment at the crown. And these arrows essentially tell you what that opposing moment should be. So there was also a similar question. How do you recommend placing attachments when the force vector becomes circular? Right? It's also a similar question. So the points where the arrows are shortest, which is somewhere in the middle of the circle, is typically where attachment placement will be ineffective. So what we want to do is we want to place an attachment, a longer attachment, perpendicular, that it crosses as many arrows as possible, more or less. So it could be a long attachment like this, as long as it stays perpendicular to these arrows. I hope that answers the question. Why do we have vertical vectors in intrusion, extrusion, and not horizontal vectors in medullary distalization, but in a circle? Yeah, it's essentially what I just answered. It was more or less the same question. I actually have a couple extra slides to demonstrate just that. Let me quickly switch to that. So imagine we have a pure mesial and distal movement. When we're doing intrusion and extrusion, there is no tipping or rotation effects happening, right? So there's no resistance that wants to rotate the tooth. There's just resistance to the translation of movement. In case of the mesial distal movement, there is the whole, the jaw there, the bone, the PDL, and the gum, everything is sitting there holding. And any kind of attempt to move it will introduce some tipping. It's shown in this slide, right? So there's going to be a reaction force, and the two forces, you pushing at the crown and the other force pushing the reaction force, will introduce a rotational tipping moment. So to counteract that tipping moment, you need to apply an additional rotational moment. And these arrows that we see here as a swirl essentially indicate what that rotational or stabilizing or counteracting the force, the rotational moment that would be counteracting tipping. That's what it's showing. So for a moron, we should place the attachment medially or distally or on the buccal surface, but rather in the center, correct? So for the moron, we shouldn't place attachment medially or distally on the buccal surface, but rather in the center, correct? Actually, I wouldn't be able to tell you this conclusively. I can only tell you that what the math says. And in the case of this particular situation, right? So the reason why we've introduced this feature is so that you can look in case by case situation. And it appears that for this case, placing it perpendicular to, so we could also place an attachment here and here, as long as the attachment is perpendicular to the arrows and it's in the place which is populated with the longer arrows, it's going to be most effective. That's what physics says. So for a moment, yeah, that depends on the type of movement you are trying to achieve. That's also accurate. Yeah, and for the movements that I've introduced here for the demo purposes, which is pure distalization, it appears that there are a few configurations that would work best. And as long as these configurations are following the two rules of thumb, which I said was first, attachment engages. So the active side of the attachment is perpendicular to the arrow, and it's located in a place where the density of longer arrows is higher. Also, another point here, you can also use the guidance of these of the vector field of the arrows to also look at whether or not you want a wider attachment. By wider, I actually mean how it's lengthwise. So in vision, it's called length, right? In some cases, for instance, here, you probably don't want too much of the attachment being in the middle here. So you want to limit its size to this here perpendicular area. I hope that the answers were kind of informative. At least that's, like I said, like I did a disclaimer in the beginning, this is not necessarily a clinical talk. I'm not a clinician, but I can guarantee you that in terms of physics and the calculation, this is what math said, what the physics said. Is it possible to see this combined force vector after staging? Is it possible to see this combined force vector after staging? The thing is, you will notice that, so if we have different key points and there are different types of movements between pairs of key points, so you do first rotation and then you do translation, say, the arrows for the initial type of movement are going to be one type, and then for the other section of movement, they're going to have a different kind of arrangement of these arrows. So I hope that's what you mean by final force vector after staging. Yeah, if there aren't any more questions, we probably can conclude. So like I said, we will be publishing the video, and I think I'll also include, I'll just improve it a little bit and include the presentation link as well. So thanks, everyone. Cheers. It was a pleasure. Thank you. Thanks, everyone.